This is In the Loop. I'm Christian Bryant. Shall we? With more developments coming on positive COVID cases in the White House, we'll contact trace President Trump to understand the potential impact and origin of his diagnosis. Plus, we ask a question that's probably come up in the last few days. What happens if either major party presidential candidate can't finish the race? We'll talk to experts about what to expect if a hypothetical scenario becomes a reality. But first, here's what you need to know right now. The president left Walter Reed National Military Medical Center today, but not before firing off a tweet saying, in part, "Don't be afraid of COVID. Don't let it dominate your life. We have developed under the Trump administration some really great drugs and knowledge." That message is something many public health experts are calling wildly irresponsible at a time when more than 210,000 Americans have died from the virus. During a press conference outside Walter Reed, physician to the president, Dr. Sean Conley, said the president has met all the criteria for discharge.
Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home.
Over the weekend, President Trump shared videos to Twitter from the hospital and took a ride outside the hospital to wave to supporters gathered there, a move that's been criticized for putting those around him at increased risk. But some of the treatments the president is receiving point to more serious symptoms. The president was given a 5-day course of remdesivir intended to shorten recovery time in COVID patients. He also received a steroid typically given to patients on supplemental oxygen and an experimental drug cocktail from Regeneron meant to jumpstart an immune defense.
We have, as do most sponsors, have compassionate use programs for all of our investigational drugs. They are not intended to allow widespread distributions, but for individuals when the treating physician applies and gets authorization from the FDA for this purpose.
It's still unclear when the president had his last negative COVID test, but if he did get the virus on Thursday, today marks day 4 or 5 with the virus.
You can be infective to other people for a day or two before you actually get your symptoms. Once your symptoms come, that's a median of about 5 days is the median time from exposure to the expression of symptoms.
At least 11 people close to the president and his circle of advisors have recently tested positive for COVID-19. The Supreme Court started a new term today with 1 vacant seat among the justices. It's the first time in 27 years Ruth Bader Ginsburg was not there to fill her seat. Chief Justice John Roberts paid tribute to her during today's meeting. Arguments in cases began by phone since the Supreme Court hasn't met in person since March 4th. The Republican Senate hopes to push through President Trump's nomination for a new justice before the November 3rd election, but so far, it's not going as smoothly as they'd hoped. See, the ceremony to officially nominate Amy Coney Barrett on September 26th very well might have been a major super spreader event for COVID-19. At least 3 GOP senators who attended have since tested positive, 2 of which are on the Judiciary Committee, which will handle the confirmation. The hope is that they can return by October 12th to begin Barrett's hearings. It's all an effort to hold the committee vote by October 22nd, for which a majority of the 22-member committee needs to be present.
I've been a leader on getting conservative judges on the Supreme Court, and the best is yet to come.
Of course, Democrats are pushing back hard.
Even though he has said it's not safe for the Senate to meet in session, but it's okay to have the hearings. And the idea of having virtual hearings where no one is with the witness for the highest court in the land, for a life appointment that would have such effect on people's lives, makes no sense.
The Gulf Coast may need to start prepping for another serious storm. Tropical storm Delta's track will move towards the Cayman Islands first, then move to parts of Cuba Tuesday. It's expected to intensify into a hurricane as it moves into the Gulf of Mexico. If Delta makes landfall in the U.S., the National Hurricane Center says a stretch of coast ranging from the Texas-Louisiana border to the Florida Panhandle will be in its path. This year's Atlantic hurricane season is on the verge of becoming the most active since 2005, when there were 28 named storms. This season, we've already seen 25. The average for a typical season is 12. When you test positive for COVID-19, you can expect the health department to begin contact tracing to ensure they're helping slow the spread and protect others within the community. There's also a certain responsibility for the person who has contracted COVID to start alerting their close contacts that they might have been exposed. It's uncertain if the White House has been doing their own contact tracing after the president's diagnosis and the diagnoses of those around him, but that hasn't stopped Newsy's Shira Tarlow from examining the president's recent travel and interactions to understand the potential impact of one of the most high-profile cases of COVID-19.
The president is the most tested man in America.
So how did he test positive for COVID-19? As with any infection, looking at the president's recent travel and interactions, known as contact tracing, is a key step to understanding the potential impacts of the most high-profile case of COVID-19 yet.
The number of people that could potentially be exposed and at risk of contracting this virus is significant here.
The incubation period for the novel coronavirus is thought to extend 14 days, with an average time of 4 to 5 days for people to start showing symptoms. And 5 days before his positive test, President Trump announced his nominee for the Supreme Court, Amy Coney Barrett, in a Rose Garden ceremony. About 105 people were in attendance, and the event was not entirely outdoors. So far, 11 people who attended the ceremony have tested positive.
When the event finished, when they were all coming up and hugging and shaking hands and saying congratulations, that's where, if I was a betting person, I would be putting my money on of where this occurred.
Later that day, the president traveled with White House staff to Pennsylvania for a campaign rally. Over 2,000 people were in attendance, and most were unmasked. The next day, Sunday, the president held a press briefing at the White House, joined by Chris Christie, Rudy Giuliani, and Kayleigh McEnany. It's Monday and 3 days before the president's positive test. The president takes part in 2 events at the White House, attended by members of Congress, Vice President Mike Pence, and auto industry executives. On Tuesday, the president travels to Cleveland for his first debate with Democratic nominee Joe Biden. Both men stand on stage about 10 feet apart. Notably, the president's adult children and his senior staff refused to wear masks during the debate, in violation of the venue's rules. On Wednesday, the president travels to Minnesota for a fundraiser at a private home, then an outdoor rally attended by thousands. Traveling with the president to and from Minnesota are White House staff, including Jared Kushner, Stephen Miller, Dan Scavino, and top Trump aide Hope Hicks, who feels unwell on the trip back to Washington and isolates herself on Air Force One. The next day, Thursday, Hicks tests positive for COVID-19. While some White House staff choose not to travel, the president flies to his resort in New Jersey for a private fundraiser, shaking hands and posing for photographs there. The president confirms on Fox News and says he and the First Lady are being tested.
She tested positive, and I just went out with a test. I'll see what, because we spent a lot of time, and the First Lady just went out with a test also.
Early the next morning, he tweets the results of the tests, positive. In the fallout, prominent figures who had contact with the president over the previous few days report their own same-day results, including Kayleigh McEnany, Kellyanne Conway, Trump campaign manager Bill Stepien, Chris Christie, 3 Republican senators, and RNC chairwoman Ronna McDaniel, all testing positive. But because tests often don't show infection until several days later, there's still a lot of uncertainty over who else in the president's inner circle or the highest levels of government could have been infected, and the impact on the election just a month away is only starting to take shape. Shira Tarlow, Newsy, Washington.
We're done playing gumshoe for now. When you're back, we'll tell you what else is going on in Twitter's trending topics.
Newsy cuts through.
When the headlines and trending topics align, that means we've reached singularity. Or maybe we're just having another busy news day. Here's what's trending. A string of all-caps tweets from the president from Walter Reed Hospital lit up Twitter this morning. And no tweet better encapsulated this stream of consciousness social media barrage better than this one, which read, Space Force, vote! Now, whatever you think of the president, you can't say wildly punctuated and capitalized tweets are uncharacteristic for him. But since his hospitalization Friday, there have been plenty of questions around how a mixture of experimental drugs he's taking to treat COVID might impact his behavior. And his social media presence Monday hasn't exactly been reassuring for many people. Another big blow to movie theaters as the second largest theater chain in the US, that's Regal, closes the doors indefinitely for its thousands of locations. The decision comes in direct response to another announced delay for the next James Bond flick, No Time to Die, which has just had its release pushed back from November 2020 to April 2021.
You're late.
When you're ready.
That delay was the last straw for Regal and the hundreds of Cineworld theaters owned by the same company in the UK.
From liquidity point of view, we were bleeding much bigger amounts when we are open than when we are closed, because we'll be like a grocery shop with no food.
And just a bit of climate news to cap off this doom scroll through what's trending. Basically, Bloomberg News got its hands on documents from the oil and gas giant Exxon that show how the company expects its greenhouse gas emissions to climb in the coming years, specifically with a 17% increase in emissions by 2025. As Bloomberg points out, that means an increase roughly equal to the current emissions output of the entire nation of Greece. Now, you may expect an oil and gas company to predict more emissions, but this plan from Exxon to put out more greenhouse gases actually comes as its competitors, including BP and Royal Dutch Shell, put out plans to cut and curb emissions. And of course, any emissions increase at that scale could be a big blow to global efforts to slow down the heating in the atmosphere and soften the impacts of climate change. So, it's a grim subject to talk about, but then again, it's been a pretty grim year. So let's just talk for a bit about what happens if, for whatever reason, either of the major party presidential candidates isn't able to carry on the race. With one candidate recently hospitalized and both candidates topping out as the oldest major nominees in US history, Newsy's Zach Toombs talked to the experts about what we can expect in some of these pretty wild scenarios.
It was once a remote hypothetical, but the COVID-19 pandemic has created some very real reasons to ask this question. What happens if a candidate for president is incapacitated or removed from the race before inauguration or before Election Day?
We have the two oldest nominees in history, and we are now facing a pandemic that impacts specifically older men in particular, and both of our nominees happen to be in that high-risk demographic.
What happens depends on when a candidate might fall out of the running, before Inauguration Day, before the Electoral College meets, or even before Election Day. That last one is a time frame that experts say leaves no room for ballot changes, but could lead the Electoral College into new territory.
We are at a point in the cycle where it is too late to replace the names of the candidates on the ballot. Most of the states, we've already passed those state deadlines. We also have the situation that in many states, absentee ballots, military ballots have all been sent. So voters are voting on the current candidates that have been put forward by the parties. But what would happen, because when voters vote for president, they are in essence voting for the slate of electors that are bound to that party. And what you would see is that the major national party would direct their electors to cast ballots for a different selected nominee for president and vice president.
If something, and we certainly hope nothing happens, to either President Trump or Vice President Biden, if something were to happen to either one of them, it's extremely likely that electors would be asked to select their vice presidential running mate, either Mike Pence or Kamala Harris.
Putting aside that possibility of a vice presidential candidate stepping in for the top of the ticket when the Electoral College votes, There's also the question of what happens if a winning presidential candidate is incapacitated after the Electoral College vote, but before inauguration. Something the experts say actually has a simple legal answer.
Now we're in the zone of presidential succession, or the succession of the president-elect. There, you don't have to wonder who's going to be chosen. There's a very distinct setup progression for that.
And all signs suggest we can take one question off the table entirely. Could a candidate's illness or removal from the race lead to a delay in voting?
No, it is in law. So in order to change the date of the election, one would have to pass a new law through the House, through the Senate, and have the president sign that law.
The election date has always, in times of war, in times of personal candidate misfortune, has always been set. It would also be hugely disruptive. Ballots have gone out, people have made plans, so Congress has the power to move the election date, but I think there is no chance that they actually choose to use that power.
The succession plan for In the Loop, in case something happens to me, is pretty easy. Just choose anyone from our ending credits and we'll be fine. President Trump is not the first world leader to contract COVID-19, but he might be one of the most high-profile cases. We're still less than a week away from the president's diagnosis, and according to Newsy's Ben Chamiso, we might be able to glean a thing or two about how Trump's illness and political influence will be impacted by looking at how other world leaders dealt with the coronavirus.
President Trump has joined the growing rank of world leaders who have caught the coronavirus. Among them, Britain's Prime Minister Boris Johnson and Brazil's President Jair Bolsonaro. The way these two leaders fought COVID-19 and coped politically may help us understand how things could play out here in the US.
It had a huge effect on the way the British government worked.
Johnson got ill in March and told his nation that he had mild symptoms. But soon after, his condition worsened to the point that he was hospitalized for a week, including 3 days in intensive care.
He tried to continue to address the nation by video, but in those addresses, you could tell that he wasn't 100%, and there was a sense of drift at the heart of government as a result.
Johnson deputized his duties to members of his cabinet during his hospitalization. No major decisions were taken during that time. After being released, he thanked Britain's National Health Service.
The NHS has saved my life, no question.
And adopted a more somber tone about the pandemic.
He was much more concerned to avoid the disease running out of control again.
But unlike President Trump, Johnson never refuted the opinions of scientists.
He was very reluctant to impose the lockdown, but he was very keen to follow the advice of the scientific advisors around him.
Johnson spent 2 more weeks recovering at home and got a short-lived increase in approval ratings.
O presidente da República, Jair Messias Bolsonaro.
Brazil offers a contrasting case study. After Bolsonaro tested positive in July, he used his reportedly mild symptoms and swift recovery to further downplay the threat posed by the virus.
Using himself is a sort of proof that the virus is not as dangerous as scientists say.
Experts say President Trump could use the same playbook to rally his supporters and boast his ability to beat the virus. But that depends on the seriousness of his case.
He'll be able to present himself as some kind of Superman who survived this disease, which will fit with what a lot of his supporters want to hear. Whereas obviously if he's laid low by it, I think that will cut against that narrative.
Ben Chamiso, Newsy.
If you're curious to know how I've dealt with the pandemic and having to put on pants Monday through Thursday, feel free to give us a shout on Twitter using the hashtag #NewsyInTheLoop. I'll keep it PG. In case you forgot, and considering the deluge of news, you'd be forgiven, 2020 is a census year. This gives us a chance to slide a word like decennial into sentences every once in a while. But much like other processes throughout the year, the census timeline has been jerked around a bit, partially because of the pandemic. Thanks to a federal judge, you still have until the end of the month to complete yours if you haven't done so already. This next story explains how this new deadline came to pass.
A federal judge told the Census Bureau late Thursday it must text every poll worker to keep counting for the 2020 census through the end of October. Let's break down what exactly happened. For most Americans, the count started in March and was supposed to end in July. The coronavirus pandemic hit, complicating usual door-to-door efforts. So the Census Bureau extended its schedule through October 31st to allow time for an accurate count. The Bureau and President Donald Trump acknowledged that it would have been impossible to deliver accurate data for apportionment by the original end-of-year deadline. But in late July, the president threw a curveball. He asked that the count be cut short again, apparently in an effort to meet the original statutory deadline. This was shortly after he issued a memo saying undocumented immigrants would not be counted. The Bureau's Associate Director for Field Operations wrote in an internal email that it is ludicrous to think we can complete 100% of the nation's data collection earlier than October 31st, and any thinking person who would believe we can deliver apportionment by December 31st has either a mental deficiency or a political motivation. Another Bureau official said shortening collection time would result in fatal data quality flaws that are unacceptable for a constitutionally mandated activity. The Government Accountability Office issued a report backing up that statement. The judge ruled last month that the decennial count must continue through the extended deadline of October 31st, but Commerce Secretary Wilbur Ross announced a target date several weeks earlier anyway. In Thursday's court order, the judge wrote the administration's lurching from one hasty, unexplained plan to the next must stop. A brief memo Friday indicated the Bureau had sent the required message to Ask Census workers to keep counting through the end of the month. If it violates the injunction again, Wilbur Ross and other defendants could be subject to sanctions or contempt proceedings. For Newsy, I'm Gage Jackson.
That's it for us, gang. As always, thanks for watching. We'll be back tomorrow with more In the Loop because, the news don't stop. Catch up with us same time, same place. Top stories from Newsy are headed your way right now.